It's my first time to attend the Greek conference on diabetes, and it's really amazing how huge it is. So I've seen during my lecture there were over 200 people live and over 200 people attending from home. So that's really an amazing crowd of people. Specifically, if you consider the topic of diabetes technology in type 2 diabetes, that might be kind of a minor part in diabetes care. So I was really amazed how attracted the crowd was by that. So specifically for those with insulin-treated diabetes, I think we have now options also in type 2 diabetes who we can treat better if we apply diabetes technology. First of all, of course, glucose sensors have proven effective. And if we think of glucose sensors, they are not only effective in those treated with insulin, but also in those who are on oral drugs, such as sulfonylureas, or even on medication that does not cause hypoglycemia. So specifically, continuous glucose monitoring has had a huge uptake also in type 2 diabetes. If you just can imagine, you don't have to prick your finger to assess your glycemia. People really prefer that. And even those who are not on multiple daily dosing would prefer to have a sensor rather than doing finger pricks. And in my country, for example, it's only funded for those who are on multiple daily injections, and those who are not, they need to self-pay, or we find to have some sneak arounds to enable it for them as well. But they really like those systems, so if we have the chance and we can equip them, they are not averse to it.
So how do you find generally, how do you see the future in the treatment of diabetes for 20 years from now?
So I guess we will see a lot of change in diabetes management already when we think of the new single, dual or triple agonists of glucagon. So we do really see a delay in requirement of insulin. Most likely we see tremendous effects on body weight. So maybe diabetes technology really can move a bit to the background in type 2 diabetes. And what we also can imagine that instead of using CGM or insulin delivery devices, it might move towards the area or era of apps. So for example, for motivation, to keep track of medication and such stuff. So that could be maybe the new aspects that come around.